Good afternoon and welcome to the 10 Big Steps to Prevent Falls webinar. My name is Tia Gully and I am a Falls Prevention Program Administrator here at the Ohio Department of Aging. I'd like to thank you for joining us this afternoon and for using this Falls Prevention Awareness Week to learn more about how you can reduce your risk of falls or the risk of fall for an older loved one. The 10 Big Steps to Prevent Falls is a collaboration of the Ohio Department of Aging's Steady You Ohio initiative and the Ohio Department of Health's Ohio Older Adult Falls Prevention Coalition. These webinars are being made available with contributions from the Holmes County General Health District, Ohio Northern University, the Ohio State University Wexner Medical Center, and Select Home Care. I hope you were able to join us for yesterday's webinar where we learned about big step number 7 and 8 and talked about how to eat well to prevent falls. If you happen to miss it, we did record it and it has been added to the SteadyU website along with the PowerPoint slides that were used during the presentation as well. So be sure to go check that out. Today's webinar is being presented by Kristen Sobota and Kelly Kroustos from the Ohio Northern University. And they're going to be talking to you about medication and falls and also how to talk to your healthcare providers about falls. So throughout the presentation, we do encourage you to use the question box there in your panel on the right side to ask questions. And we will hold those questions till the end and present them to Kelly and Kristen, and they'll be able to answer all of those questions at that time. So please join me in welcoming Kelly and Kristen.
Thank you, Tia. Oh my gosh, happy Falls Prevention Awareness Week to everybody out there. We are so honored to be a part of the presentation today, and Kelly and I are just so excited to be here with all of you. And you know, like Tia said, if you have any questions, please feel free to send them to Tia. And then when Kelly and I are done, Tia will address those questions for us to be able to answer you. So again, happy Falls Prevention Awareness Week. And today we are going to be talking about steps 9 and 10, which are talking with your healthcare provider about falls. So Tia's going to advance our slides to the first one. And, you know, for healthcare providers, please, you know, keep in mind that that includes all of those healthcare providers that are taking care of you. So talking to your doctors, your pharmacists, your nurses, your nurse practitioners, your therapist, you know, physical therapist, occupational therapist, all of those people have a role in preventing falls, okay? So definitely reach out to all of those different healthcare providers. So Kelly and I are both pharmacists. We are teachers here at Ohio Northern University in Ada, Ohio, and we are located here in Hardin County. It's a beautiful fall day, and you know, we love being here in Ada. We're out here surrounded by
cornfields.
Lots of cornfields. Yes, it's beautiful out here in Ada, but that's where we are. So we're coming from a pharmacist perspective, and we are going to talk about different medications throughout this presentation. So again, we will be talking about different medications that you could also talk to your pharmacist, you know, about. So remember that any medication that you do take can have side effects, okay? And you always want to make sure that the benefit of taking that medication helps you more than the harm or the side effect that it could cause, okay? And a lot of the medications that we will be discussing today do have side effects that include dizziness, drowsiness, lack of balance, or vision impairment, and all of those can cause falls. So just being aware of those side effects are key when you are taking medications. Okay, you want to always make sure to discuss your medications and any concerns about falling with your doctor and your pharmacist every year. Okay, so once a year, you really do need to have that discussion with those individuals that are prescribing your medications, as well as looking at those medications, you know, on a monthly basis, your pharmacist, so that they can review those medications to see if any of them could potentially cause a side effect like dizziness or drowsiness that could cause a fall. You want to make sure to be able to read your prescription label and to look for any warnings about drowsiness and dizziness or driving or operating machinery. Okay, so anytime you get that prescription bottle, you want to make sure to look out for those labels that do cause, those warnings for drowsiness and dizziness. If you're unable to read a label, please just always reach out to that pharmacist where you picked up your medications. And for sure, he or she would be more than happy to help you interpret or read that label for you, okay? You also want to make sure to let your doctor know about any concerns you have relating to your medications, okay? You never, ever want to just stop a medication unless you've had that communication with your doctor, okay? Sometimes it could be extremely dangerous if you just all of a sudden stop a medication, okay? So never stop a medication, and always talk to that doctor if you have concerns for wanting to discontinue that medication at that time, okay? And then last, whenever you are prescribed a brand new medication, you always want to talk with your doctor or your pharmacist and ask if that new medication could increase your risk of falling. Okay, so communication with your healthcare providers, especially the one that's prescribing your medication, probably your doctor, and then your pharmacist, the one that's going to be giving you your medication, is important, especially in regards to falls.
All right, go ahead and next slide. All right, lovely. Well, hello everyone. I am Kelly. I'm very excited to be here. I work and provide pharmacy care for seniors at a local long-term care and assisted living. So I have been serving our senior community for a very long time, and I absolutely love it. And I feel so fortunate to not only teach within the College of Pharmacy here so I can educate our students, but that I get to speak with you today. So happy Friday. Let's just get things started off right. It is fall in Ohio.
It's allergy season.
It is allergy season.
Yes.
Let's just get straight to the point. Well, maybe not everybody, but many people are experiencing some type of allergy symptoms right now. And if you are one of the few fortunate ones, and I wish I could see your beautiful faces and like the eye rolls of, oh God, yes, allergies. Maybe some of you do not, but this is cold season, this is allergy season. So really stopping and taking a look at the antihistamines that we're currently using. I just have one up there right now, and it's Benadryl. And Benadryl is a very effective antihistamine. It's one that's been around for a very long time. We use it for allergies and colds, itchy eyes, running nose, sneezing, everything. And it does work. The trick with this particular antihistamine is that Benadryl kind of hangs out in your body a bit longer. So in the older adult population, your body just hangs on to Benadryl a bit longer. And while that sounds great from an allergy standpoint, the risk is that it can lead to falls, drowsiness. It could make you feel a little bit confused or even kind of disoriented, maybe out of sorts a little bit. It can also contribute to dry mouth and constipation. So this is a medication that I like to make sure that all my seniors are aware can cause this type of side effect. If you're not experiencing side effects, that's wonderful. If you are having communication with your doctor and pharmacist and letting them know that, wow, it just really makes me feel a little bit confused or a little bit dizzy when I stand up, that's good to know, because there's other antihistamines out there that have less of the side effect. So that's one of the wonderful things. You're not a burden to anybody. You're not bothering anybody with side effect discussion. It's as easy as saying, oh, well, if Benadryl's bothering you, there's Claritin and Zyrtec and Allegra. There's there's a whole slew of other options. So we really would prefer you to be very cautious in using Benadryl and maybe trying one of the other ones sometimes. So next slide. We'll go ahead and move right on to blood pressure medication. These are some very specific blood pressure medications, and I know there's a whole host of other drugs out there that impact blood pressure.
So many medications for blood
pressure.
So many. And you might be on a couple for blood pressure.
Probably. And so these particular ones are used for blood pressure. These particular ones are also used for something called benign prostatic hyperplasia, or BPH. That's an enlarged prostate. And so sometimes people will be on other medications for that, as well as their blood pressure. So anything, any medication that lowers your blood pressure can cause you to experience dizziness, lightheadedness, particularly when you're changing positions from either sitting in a chair or laying down in a bed in the morning to getting up in the morning, any sudden change in position. So a couple of the things, we're not asking you to stop taking your blood pressure medication. That would probably not be a good situation.
Yes, never stop.
Never stop. But be aware that any medication you take for blood pressure can cause you to experience these sensations. And so take your time standing up, grab onto the armchairs, maybe pump your legs a little bit. Steady yourself with a counter or the arm of the chair.
Definitely take your time.
Definitely take your time in getting up. There's no race, at least not one that I'm aware of. And so just take your time and be cognizant that it can make you feel this way. Okay, so I think raising awareness is just one of the keys there. And if you really feel awful, like every single time you stand up, you almost fall down, that is most definitely a time to let somebody know. You can let your pharmacist know, you can let your doctor know. We're all on the same team here. We're on team you. And maybe a dose is too high, it needs to be adjusted. Maybe a different medication would be better tolerated by you. They can't read minds. I've been trying unsuccessfully. So just let them know, okay, that you're experiencing these things, because we want you to be safe at the end of the day.
And a pharmacist
yes,
can take your blood pressure. There are a lot of community pharmacies that have blood pressure machines. So, if you can't get into your doctor's office, feel free to go to a pharmacy where they could also check your blood pressure at that time.
100%. Next slide. All right, moving right along to diabetes medication. There is a whole truckload of these as well.
Lots of diabetes medications, lots.
From injectables to oral tablets, lots of different types of options.
Yep.
So we have a few listed here. So the whole goal with medication used to treat diabetes is to lower your blood sugar, to make you a touch less sweet, so to speak. And in doing that, not only do we lower the blood sugar, but sometimes in doing that, if the blood sugar goes too low, it can make you feel not real swell. It can make you have symptoms of what we call hypoglycemia, or low blood sugar. And maybe several of you have experienced this before, feeling lightheaded and dizzy, maybe kind of sweaty and clammy, maybe shaky, even nauseous. And all of those are a combined recipe for falls. Again, it's important to track your blood sugar. So if you've been provided with a glucometer, it's important to check your blood sugar, particularly if you're feeling this way, because maybe your blood sugar is so low that you need to have a glass of orange juice, or you need to correct it. Sometimes the doctor will give you little tablets to take to raise your blood sugar. And that information definitely needs to be communicated. A lot of this, because you are home, you don't live with your doctor. Maybe some of you do, I don't know. But most of us do not live with our doctor, and you're at home, and the only way they can take care of you is if they know what's going on. So for your sugar, when you're feeling this way, test your blood sugar, write it down, give the office a call, let them know, or let them know at your next appointment. Again, they can't read your minds, so that's why taking those blood sugar logs to your appointment are very, very important. And it's important to let them know, because maybe it needs adjusted.
Again, and same with like the medications we just discussed,
Yes.
getting up slowly, you know,
Slowly.
take your time if you do feel dizzy on any diabetes medication.
Absolutely. Absolutely. Next slide. All right, so muscle relaxants. I don't know if anyone else overdid it this summer, but I sure did. I overdid it. I was laying mulch and all kinds of stuff. So there are different times in our life that we are needing medication for pain management, and muscle relaxers are kind of that special class used for muscle spasms. Usually they're used on a short-term basis, but sometimes they can be used on long-term and ongoing. It just depends on your situation. Because they treat muscle pain and tension, they relax the muscles so they don't hurt, and therefore they kind of relax the rest of you too. And so it's expected that they would cause you to experience drowsiness, dizziness. They can increase your risk of falls, most definitely, risk of fracture from falling. So again, if you do have to take these because of an injury or a condition that you have, you will want to make sure that you are aware that they can cause you to experience this. Stand up slowly and take your time and report how it's making you feel, because oftentimes on medications, like we'll talk about opioids here in a moment, but for muscle relaxers, it's very easy to cut the dose down, but you got to do that, you know, with the oversight of somebody who's taking care of you, like your doctor or pharmacist. So if they're making you feel that way, definitely let somebody know.
Absolutely. Always report any of these symptoms, this dizziness, drowsiness, again, to your doctor or pharmacist.
Exactly. Next slide. On with a class of medications that are commonly used for feeling nervous. They're called benzodiazepines. And examples in this group include medications such as Xanax, Ativan, Restoril, maybe even Valium. Sometimes, again, these are medications that can be prescribed for kind of a short-term situation. They can also be for long-term. It just depends, again, what you're treating. So sometimes they may use them for you to help you fall asleep, maybe that feeling of anxiety or kind of jitteriness, nervousness, if you've got the nerves. It can definitely cover that as well too. Again, you think of anything that helps you fall asleep, anything that relaxes your anxiety, it's not just going to do it one place, it's going to do it all over. So
absolutely,
the risk of confusion is very, very high because it's relaxing you, and it may make your thoughts feel very slow and sluggish. So it'll impact your reaction time. So you know, popping a Xanax and going for a drive is not the best idea for anyone, but definitely as we age, your body hangs on to these drugs a lot longer. So a smaller dose impacts you in a very large way. So falls, fractures, slower reaction time when driving a car. Again, slow everything down. I feel like the answer to most everything today is to just slow down and communicate. So,
and again, reporting any symptoms, because a lot of times the dose could be decreased or cut back. Yes, absolutely.
Yes, absolutely. Very good.
Next slide.
On the thread of sleep enters Ambien, Lunesta, and Sonata. These are just a few of the other medications. They're almost like cousins to the benzodiazepines, which are the Ativan. It's like their cousin. They're kind of related, but they're still totally different people. These are used exclusively for sleep. Okay, so again, you take it around bedtime. I know I have several seniors that are prescribed this, and they take it for sleep on a regular basis. And the important thing is that you take it, 30 minutes to an hour before you go to sleep. Don't take it after dinner and then go out for a drive. That's not a good idea, but take it when you're in for the night and making sure you're not going out, because it is going to help you sleep. It is going to relax you. It's going to relax all of you. And so that includes, dizziness, drowsiness, confusion, falls, all of those things. And this one has most definitely been linked to delayed reaction time. There's been information out there about motor vehicle crashes. I always think that all medication come with a cost. and the cost is the side effects. And so some of the cost is higher than others. Okay, and this one, they work for sleep, but they also work to cause harm if they're not taken carefully. So, so you just want to make sure that they're working for you. If you are on a medication for sleep, make sure that it's actually helping you sleep. If it's not helping you, don't take it. It's not worth the risk.
Right. And like Kelly said, make sure you take it right before bed.
Right before bed.
Do not do other things. Don't be cleaning. Don't be driving.
Don't decide to like paint your walls
Exactly.
like right before bed,
Definitely.
or rearrange the spice cabinet or
Yes,
something.
definitely go to bed, you know, as soon as you take these, to again decrease that risk of the falls and the, you know, confusion, etc.
Absolutely.
Okay.
Next slide. Antidepressants, these can include a variety of different things. There's Celexa, Zoloft, Lexapro. There's a wide range of these as well too. And they can be used for feelings of low mood, such as depression, and also actually even helping you feel better when you feel nervous all the time, such as anxiety disorders. And they have an increased risk of falls. I would say generally my experience has been that it's not, the risk is much higher with like an Ativan or the sleeping medication, but you still need to be aware, especially when you're first starting an antidepressant, or if they're changing your dose, that you may experience dizziness, lightheadedness, maybe, you know, especially when you're changing positions. Anytime there's a change, you know, they're just starting it or they're changing a dose or decreasing a dose, that you may experience this for sure. It's usually a side effect that I find that my seniors become very tolerant to. The ones that don't, there are a wide variety of antidepressants. That's the thing. They're almost like shoes, you know, for the ladies in the audience. You go try on a pair of shoes and it doesn't feel good on your feet. You got to like tell someone so they can bring you a different pair of shoes. And antidepressants and most medications are similar to that. But if you don't tell anyone and just wear the shoes, well, your feet are just going to hurt.
Right.
So
they have to find the right one.
You have to find the right fit,
good
because my body doesn't react the same as your body, Kristen.
Absolutely.
And if I could see all you lovely people, I would tell you that too. So it is just like shopping for shoes. So let people know. Next slide. The anti-inflammatories, I know a lot of these are over the counter, so they seem very benign, but they are not. So pain, inflammation, arthritis, all the good reasons that we all enjoy anti-inflammatories. What I want you to know is that if your doctor has recommended you take one of these medications, maybe like Mobic, or they want you to take a regular naproxen for whatever painful condition, they know that you're taking it and they're monitoring you for it. They're making sure that you're not at a bleeding risk, that your kidneys are all good and your blood pressure is spot on. But if you go over the counter and just grab something from the drug aisle at Walmart, nobody knows you're taking that but you. So you have to let people know that you're taking those medications. You let your pharmacist know, you make sure you let your doctor know. So that way, everybody's on the same page. There's no surprises, and they know to monitor for it, because these medications can impact your bleeding. They can impact your kidneys. They can increase your risk of drowsiness, and they can cause a lot of problems with your stomach, such as bleeding or even contributing to ulcers. So again, we're not mind readers, unfortunately.
Yeah, and Kelly has a great point. You know, there are so many over-the-counter products that do have, let's say, ibuprofen in them. So definitely let that doctor or pharmacist know that you're taking that product. Because again, just because it's over the counter does not make it safe.
Correct. Correct.
It's safe when it's used correctly, and it's safe as long as you have, you know, you don't have other conditions that, you know, contraindicate that use. So, you know, be careful, you know, especially with the ibuprofen, because there are so many cough and cold products that have ibuprofen.
Oh, great point, Kristen.
It's
great
in
point.
a lot of over-the-counters that, like Kelly said, you could just go and get, and nobody knows you're on it. So have that conversation, you know, with your pharmacist if you're picking up a product, but, you know, definitely be careful with these products if you are not being monitored by your doctor or your doctor is not aware that you're taking them.
Absolutely. Absolutely. I love that you brought up the combination products because we
Yeah.
are in that season.
We are in cough and cold season
Cough and
right
cold
now.
season,
Yep.
flu season, and we think, oh, I'll just get some NyQuil, but there is like all kinds of magic inside NyQuil. So, you
lots
know,
of
lots
of medications
things.
are in one NyQuil product.
And maybe it's maybe you're already on one of those medications, or maybe it interacts. So never hesitate to approach the counter. I mean,
absolutely go to that pharmacist.
Like
yep.
we love talking about OTC products. Like that is our like wheelhouse. Like
yes.
come and talk to us. I mean, we love prescription medication too, but
go right
never
to the pharmacist
hesitate.
if you have a question.
They're never too busy. Even if they look like they're running around like a chicken with their head cut off, go and talk to them. You'll make their day. I promise.
Yes.
I promise.
Yes.
Next slide, please. And then I think the last group of drugs, or maybe there'll be one more, is the opioids. So this is a pain medication that you would take for either kind of a short-term procedure or maybe long-term for a condition. Everything that we said about muscle relaxants definitely applies this too. So it's going to decrease the pain in your body because it's going to block it. It's going to block it from getting to your brain, and because of that, it can lead you to dizziness, drowsiness, and some confusion. And through that, you can have an increased risk of falls. These lovely medications will constipate you. Like there's no and, ifs, or buts. So watch your bowels, everybody. And if taken at higher doses, it can impact your breathing. So you want to be very sensitive and very aware of how these medications make you feel. If they make you feel dizzy and drowsy, maybe impact your breathing or your ability to stay awake, then that needs to be reported for sure, because these are medications that can be adjusted. There's not a gold dose. It's an individual dose. Your dose doesn't match my dose, which doesn't match Kristen's dose. So there's a theme here, and it's all about communication. Next slide. The last drug I really want to hit home is coumadin. So some of you may be receiving coumadin for treatment, or for some irregular heartbeats, maybe a mechanical valve. Other of you are on Plavix, maybe an antiplatelet drug. You also could be on Eliquis as well. So anytime you're on a medication that either kind of thins out your blood or makes your blood stick together less, like aspirin even, it's going to increase your risk of bleeding. What I want you to know is that if you trip or fall or stumble or bump against the wall or hit your head doing something, you need to let somebody know about that, because it increases your risk of bleeding. And if you do some type of trauma to your body or to your head, you may be bleeding. And so we just want to make sure that no fall is too small. All trips should be reported. If you're like, oh, I didn't actually fall, I just stumbled and lost my balance and hit my head on the corner of the counter. Okay, that's a fall. Okay?
Absolutely.
Report that.
Yes. And especially, with this medication, it just could be dangerous, like Kelly went over all of that, with that increased risk of bleeding. So if any of you are on coumadin or warfarin, or again, any medication that thins that blood out, definitely be aware of your surroundings and, really
Slow down.
Slow down.
Right.
Yes, absolutely. Because we do not want you to fall on this medication. Okay.
Absolutely.
Especially for that, risk of bleeding.
Yeah, because we don't want you to bleed where we can't see it. We don't want you to bleed at all. But a scratch on the knee bleeding is different than a bleeding inside your body. So that's the biggest risk that we're concerned about. Okay. Next slide.
Okay, so Kelly and I have the pleasure of not only educating the pharmacy students here, in the classroom, but we get to go out in the community with our pharmacy students so many times a year to different places, such as senior citizen centers,
councils on aging.
We go to councils on aging. We have gone to health fairs. we've spoken for the Silver Sneakers, you know, at the YMCA, the Matter of Balance program in Hardin and Allen counties. So we absolutely love talking to seniors in the community about their medications, you know, and again, you know, like Kelly said, just know the medications you're on and their side effects, you know, don't stop anything, but just know, you know, what medications could put you at risk for falling. So again, we do have that opportunity multiple times a year to go out in the community and share this advice with different seniors. So these last few slides, we do tend to take to all those different places when we educate seniors. We usually end on these slides because these are just some really, really good strategies or just information on managing your overall medications. So again, this is how we'll sort of end the presentation. It's just these take-home tips, you know, these really important points to just kind of think of, you know, when it comes to your overall health and using medication. So it's really important, if you can, to get all your medications dispensed at one pharmacy, okay? It is very safe because that pharmacy has your list of medications and your profile history and the medications you've been on in the past, and they know you best, okay? It's dangerous if you would go to multiple pharmacies because those pharmacies don't necessarily talk or communicate with each other. So for example, if you go to Walgreens for one prescription and then Rite Aid for another, and then Walmart, you know, those computer systems do not work together and they will not be able to see your medications at your other locations. So again, if you could stick to one pharmacy and really get to know your pharmacist, it really is important. You know, you should know your pharmacist's name just like you know your doctor's name, okay? Because you really want that pharmacist to know you and know who you are. So definitely try to, again, go to one pharmacy and know who that pharmacist is, just like you know who your doctor is. For your medications, it's really important once a year that you touch base with that pharmacist so they do have an up-to-date list of all medications. And when we talk about all medications, we are talking about your prescriptions, your over-the-counter medications, and any vitamins or herbals or dietary supplements that you take, okay? So like Kelly had talked about earlier, obviously a prescription, you know, you're going to get that from a doctor or a nurse practitioner. They're going to be monitoring you on that medication. But over the counters and vitamins and herbals, you could just go purchase yourself and nobody knows you're taking them. So again, once a year, you really want to make sure your doctor and your pharmacist is aware of all of those over the counter as well as vitamins and herbals that you're purchasing, because they too can interact with medications. So again, prescriptions, over the counters, and vitamins, herbals, dietary supplements, once a year, make sure your doctor and your pharmacist have that up-to-date list. Okay, next slide. We all know that, you know, we're on several, you know, different medications. That's normal. You know, you might have to take a medication at breakfast, a couple at, you know, maybe at lunch, some at dinner. That's normal, right? As we get older, we're on multiple medications that are to be taken different times a day. So in order to remember to take those medications, try to, you know, set an alarm on your cell phone. You know, a lot of times, you know, we all have cell phones that have an alarm. If you could do that, maybe put a Post-it note somewhere, maybe near the coffee machine or on the fridge, somewhere where you're constantly at, you know, multiple times a day, in order to remember to take those medications at the different times. So setting an alarm, putting a Post-it note, it's something that you could consider doing to help you remember to take your medications. If you need a pill organizer, again, usually the pharmacy sells a different or a variety of types of pill organizers to take. They're very, very inexpensive. I know the Dollar Tree sells these for $1. So again, if you're looking for a pill organizer to keep those medications in one place, you can purchase one for $1 if you can, to again help you remembering to take those medications. If you have expired medications, or you're no longer taking medications, please consider doing this once a year, okay? We all know that you probably have a medicine cabinet somewhere, right? Or a medicine drawer, and it's so easy to just maybe purchase some over-the-counters and throw them in that drawer, but then you forget to look at that expiration date. So I always like to educate seniors wherever we go that on January 1st, the very first day of the new year, try to remember to take out all of those medications that you have, purchased out of your cupboard or your drawer. And once a year, look at your expiration dates on those drugs. Okay. I can't tell you how many times we have maybe gone to maybe individual senior homes, looked at medication or done like a brown bag, and people just bring in expired drugs, especially over-the-counter drugs, don't even realize they're 5 years outdated.
And I got to
right?
tell you, I'm guilty of this myself too.
Right.
I've got expired medication and it's so easy to accumulate.
And it's so easy to forget to like look at the date. So, once a year, again, January 1st, try to remember every year, I got to take out all my medications and look at those expiration dates. And, a lot of times if you're not comfortable, how to dispose them, usually a lot of towns will have, or cities that you live in will have these medication take back days. I know a lot of the hospitals will also have a collection bin where you can take your expired drugs, but please just try to once a year notice those expiration dates on all of your medications. Okay, next slide. Again, we've talked about earlier to really be aware of the common possible side effects for each of your medications. So again, the very first time you're prescribed a medication, definitely look on that label for any of those side effects. Talk to your pharmacist about the common side effects, again, especially dizziness and drowsiness that could cause you to fall. Make sure to refill your medications before you're completely out of them. So definitely don't wait till the very last pill is in your bottle. You want to give a couple days notice before refilling your medications. When you're storing your medications, you definitely want to make sure that you are not storing them in a very hot or humid place. So a lot of times, if you have a small bathroom where that bathroom cabinet, fogs up from the shower or the steam, that's probably not a good location, again, because of that humidity. Same thing with a car, especially in the summer days in the heat, never ever leave medications in extremely hot or extremely cold places, okay? So just kind of be on the lookout for that. And always, always, always have a medication list on you, okay? Keep it up to date, okay? So on that medication list should be your drug name, the dose of the medication, how you take that medication, and what it's used for, okay? Because, we were talking earlier about, let's say, blood pressure medications, and so many blood pressure medications are also used for congestive heart failure and other conditions. So we really need to know why you're taking a medication, so what it's being used for, okay? If you can, have a start date and a stop date on that medication list, because, like Kelly said, some of these medications you might just take just for a few weeks and that's it. Or there's other medications you've been taking for so many days for several years. So again, making us aware of, how you're taking that medication. And then last, who is the prescriber for those individual drugs? Okay, next slide. And then our last slide is really just engaging your doctor and your healthcare providers. Because again, there's so many different healthcare providers that can prescribe you medication, whether it's a doctor, nurse practitioner.
Right.
I mean, in some states, pharmacists
Yes.
can prescribe medications. Again, it depends on what state you're living in. So, you really do need to engage all of those healthcare providers in this discussion with falls. So if you are seeing more than one doctor, which is so common, it's so common to have specialists, especially, for certain health conditions. If you're seeing more than one prescriber who is giving you a medication, they really do need to be aware of all the medications you're on. So that list, again, that medication list has to really be very complete with all of your providers. So your medications, again, that includes your over-the-counter medications, your herbals, your vitamins, and again, it has to have the name of the drug, the dose, how you're taking it, and why you're taking it. Really needs that complete list, and it needs to be shared amongst all those providers that are in your individualized care. Okay. And when it comes to falls, there's a lot to discuss with these healthcare providers, when it comes to falls and falls risks. So, and I think Kelly talked about this earlier. Anytime, you're feeling something, a side effect, you need to have that conversation. You need to communicate. We're not mind readers, right? We have to have that communication.
Yeah, and oftentimes there's many different options of medication that we can go with. And so there are typically other options as well.
Right. They could decrease your dose or change you to a different drug that could be safer.
Again, think about shoes.
Yes, absolutely. Absolutely.
And I do think actually talking with them about when you're with your provider about, I am concerned of falls. What can I do now? Could I see someone to learn some exercises? Could they recommend some strengthening? That is well worth it, because a lot of being safe is keeping your body moving and keeping your muscles strong, and being sensitive to when you might need a medical device like a walker or a cane or something to add that extra stability.
Right. And then, going along the lines of exercise and strengthening, we all know Tai Chi, how important that is. And if you could become a part of Matter of Balance at some points, that is so important to be able to, again, have that discussion with your providers to utilize resources like that in your community.
And then also asking your doctors, there are various falls assessments that can be done, and maybe bringing up your interest in discussing falls and looking at your individual risk and looking at your individual strategies to decrease it. It will improve health. It'll decrease future complications. It'll help you live independently, or maintain your independence. There's just so many good reasons to ask more about the falls assessment or a different type of falls evaluation, falls risk evaluation within your doctor's visits.
Right. So your provider could perform this assessment or evaluation at your visit to really just give you an overall picture of your falls risk. So we are just so happy to have, been with you all today, out there, wherever you are in Ohio. I know at this time, Tia will let us know if there's any questions. We are so thankful that you allowed us to come in your homes or wherever today to just talk a little bit about medications and, just being able to talk with your healthcare provider when it comes to falls.
Yes, thank you all.
Thank you. And we didn't have any questions, but we did have a comment that I think was a really good something to share that you all hit on. We have an attendee who mentioned that they are currently taking medication that is usually prescribed for blood pressure issues, but they're actually being prescribed it for acne and rosacea. And so they were really surprised to see that the side effects for that was dizziness. And she made a point to say it's always good to read the prescription insert.
Oh, she can join us for the presentation. What an absolutely. I bet that was spironolactone that she was talking about.
Yeah, that's right. There are, some of these blood pressure medications.
That's a great reminder.
That they actually do use for acne. So, great point there.
Great point. So many times blood pressure medications or medications that impact blood pressure can be used for lots of different conditions. So I just think it's so valuable to just be aware of what can make you dizzy. And obviously, the more medications you have that can cause you to feel dizzy or drowsy, the more you're going to feel it. So I just feel like it's good to be aware of that. So if you're experiencing, you're feeling more empowered or more validated in what you're sensing to go talk with somebody.
You know, and that's why, again, it's so important too, if you do have that med list, to tell providers why you're on it, because that was an exceptional point. You're so right. It's a common blood pressure medicine, but it does, there is one that a lot of times is used for acne. So, you know, you just gotta have to, you know,
excellent point.
You know, let your providers know, you know, why you're taking something. So, you know, great point. And
great point. Thank you for sharing.
Yeah, she did comment and say that you guys, that was the medication. And so you guys,
we got it. What a lovely reminder.
Yes.
Thank you to her.
Yeah, and you know, and I think Kelly had talked about earlier, you know, anytime you start a medication, you know, these side effects a lot of times, you know, will hit you, you know, right away, you know, or sometimes they may last, but have that conversation, really let your providers know if you are experiencing anything.
Yeah, I want you guys to really leave here feeling that empowered and that you obviously have a right to your health and to advocating for yourself and being aware. And just because somebody doesn't mention it to you doesn't necessarily mean they're a bad doctor or a bad pharmacist. But you need to advocate for yourself too, and communicate your concerns. And, you know, falls is a legit concern. So for sure.
Absolutely. We had one more comment about trazodone being used for insomnia, even though it's an antidepressant. So I think just on your point of the multiple uses for some of these medications, and so the importance of following up to make sure you know what the side effects can be.
Absolutely. So you're 100% right. Many of my seniors do take trazodone for sleep, and trazodone is considered an antidepressant. But at lower doses, they use it for sleep.
Very common.
Very common.
We see that a lot.
I mean, even my students, you know, they may take trazodone for sleep. Adults take trazodone for sleep. So for sure, yes, being aware of what you're on. Oh, it's an antidepressant. Oh, I'm using it for sleep, but it, you know, it still shares all the same side effects. So excellent. Sounds like they know their medication.
Yes, you guys are good out there.
I know. I wish I could see your faces and talk with you.
Well, those were all the questions that we have. So I'd like to thank you both so much for sharing with us this afternoon. The information you presented was really good. I think that as we can see, we got a lot of people who definitely could relate to what you were talking about. So I think that we have lots of people who learned things today. So thank you so much, Kristen and Kelly.
And thank you so much for this opportunity as well.
Thank you. So as a follow-up to this presentation, we would like to invite you all to participate in the last big step, which is big step number 10, and that is for you to complete a medication inventory and to discuss it with your healthcare provider. So Kristen and Kelly talked about having the annual medication review. So we, just challenge you all to take some action to what they talked about today and talk to your healthcare provider about your medications, request a medication review so that we can help make sure that we're keeping you safe. Please also note that a recording of this webinar will be available on the SteadyU website here very soon, in addition to the PowerPoint presentation that was used. That will also be posted. So this is the end of the 10 Big Steps to Prevent Falls campaign. This is our first time doing this, and I am very pleased that we were able to pull it off. These are different times, and it's unfortunate that we weren't able to get together for our 10 million steps to prevent falls like we usually do for Falls Prevention Awareness Day. But I think that this was a great learning opportunity with the 10 Big Steps to Prevent Falls. And I really would like to thank you all for joining us all week long. I hope that most of you were able to attend every day. Again, if you weren't, all of these presentations are going to be posted on the SteadyU website in addition to all of the PowerPoints. I'd also like to send a huge thank you to the Ohio Older Adult Falls Prevention Coalition for assisting with helping us to plan this. Particularly the speakers who so graciously agreed to help. So Sean Weiss, Carrie McQueen, Ann Smith, Kelly Kroustos, and Kristen Sobota, as well as Carmen Clutter from the Ohio Department of Aging. So we would like to thank all of the presenters this week. Everyone else, if you would like to visit the SteadyU website to access more information and resources about falls prevention, we invite you to do so. And we hope that you will continue to engage with the SteadyU website so that we can help you to prevent falls all year long. So again, thank you all for joining us. If you have any questions, feel free to shoot us an email, and we look forward to talking to you all soon. Take care.